So you found Skedulo and it seemed like the right solution for you to implement across an organization with so many different stakeholders. Is a challenge for any organization. You'd already gone through a process. So how did you build up the trust, and what was the process like to actually roll out Skedulo across all those different departments?
There's a saying that we use around here, which is turn on your blinker. The way we sort of approach these things in the past is we'd want to have all of the answers and all of the solutions and anticipate everything, and then we would bring it to our team and say, and surprise, here's what we're doing next. We sort of have transitioned into this way of just turning on our blinker in what direction we're heading. So we had gotten this feedback from our team that really the previous solution that we were on wasn't meeting the needs. And so just letting them know, we hear you, we're exploring this. And we don't have an immediate solution. We're gonna take our time and make sure we get this right for you, because change is hard for anyone. So I think just alerting them to this change that's coming way in advance, even though we didn't have answers, really helped build the trust. As well as when we started talking about it, and once we had identified Skedulo as the solution, we let them know that, and here's why we chose it. And I think always going back to the why and how it's gonna make not only their lives easier, but it's gonna improve their patient satisfaction. All of our clinicians are in this to make a difference for their families, and so always helping them understand how some of these operational things really impact our families, I think really led to a lot of trust and building that up as we headed towards implementation phase.
So what we realized once we had chosen Skedulo as our solution was we wanted to move very quickly. We recognized immediately the kind of impact that it would have across all of our departments, and we were very eager to make this transition. We also had an audit scheduled for the end of last summer, so we thought, great, our timeline is August, let's get this moving, let's get everybody switched over. And then we really had this moment of pause and reflection of how did we roll out the system last time? Was it a positive experience for everybody involved? Could we do a better job? Could we explain more about why we're making the changes that we're making and make sure that we're setting everybody up for long-term success? And so we slowed down a little bit, and we really took the time to meet with everybody in the leadership team to better understand how this type of change would impact every single department. It might not seem like a scheduling software might impact billing or might impact our health information management team or our nursing team, but it really truly does. And so taking the time to understand that and understand what every department needs from this software in order to be successful as a whole organization was really valuable.
What are the ways in which Solace is actually using Skedulo?
The number one way is really the actual scheduling. So we receive referrals, like Darcy said, from all sorts of different partners within the community. We want to make sure that we are matching the best clinician with the best skill set for that particular child every single time. And that's really what the system has allowed us to do. So as we get a referral for a patient, for example, who needs a Spanish-speaking therapist with feeding expertise in this particular area of Denver, we want to make sure that we're scheduling somebody who matches that skill set to make sure that we're serving that family the best way that we can, but also that we're finding a clinician in that service area so that we have that continuity of care for that family. So again, as Darcy mentioned, that we are avoiding any sort of transitions, unnecessary disruption of services for these kids. So that's definitely the number one way.
When we looked to make this move, we were really trying to also engage sort of differently with our customers. So with our families, for instance, we've utilized the system to allow us to communicate more directly with them. So now we're texting them when we have found an evaluation spot for them. So we're not having to play phone tag and make sure that this works and they're calling us after work or they're busy with their children. So it's just streamlined that communication with them. And then we're also texting them a reminder 24 hours before the appointment. And then again, when our clinician is on the way. What would happen before is a clinician would come out of an appointment, they're set up back to back to back, they come out and they're running a few minutes behind. And so they text really quickly to that family and say, I'm running a little bit late, I'll be there in 15 minutes. Now the system will do that for them. So when they say they're on their way, the family gets a text and it notifies them that it'll be about 15 minutes and then they'll be there. We've tried to engage our families in this process as well.
And also on Sunday afternoons, the family gets an email and it has their calendar for the week. So a lot of our families receive multiple services from Solace. They might receive all 3 therapies, which means a lot of different days, a lot of different juggling for schedules. And so that's our way of saying, here is your outlook for the week. Here's what you can prepare for. Don't forget, you've got physical therapy on Thursday afternoons with this person, and it helps set them up for success and also really significantly impacts our clinicians because then our clinicians aren't showing up to, people forgetting about their appointments.
The clinicians can just focus on the care, right? They don't have to worry about mapping out their day and responding.
Exactly, and that's the biggest thing. We've taken not just the administrative burden off of them, but really that scheduling efficiency piece. So if we can have visibility into their schedules, which Skedulo allows us to do, we can see, okay, well, for Susie, this patient makes the most sense, not just now, but 3 months from now when this child is potentially going to still need those services.
What about some of the reporting functionality that you have or may have as you continue to build this out between Salesforce and Skedulo? What does that allow both of you to do in your roles?
Historically, we've used our electronic medical record to gather all of our metrics. So it gives us information about how many visits a week are we doing, what types of disciplines, how many missed visits do we have, things of that nature. What we've really been looking to Skedulo and Salesforce for is just a bigger picture view outside of those smaller metrics. So for example, one of our biggest goals is to make more strategic decisions that require coordination between the therapy team and the marketing and recruiting team. As we have visibility into schedules and caseload capacities and openings in different areas for different disciplines, we're able to have more intelligent conversations with our recruiting team to say, you know what, it looks like we're having a really hard time scheduling after-school appointments in this particular area for this discipline. And at this point, we think we need to add more people to our team. So it's really elevating our game from a recruiting standpoint and also just from a operational standpoint in general. As we have more visibility and we're able to collect more information, we're able to coordinate with different departments to make sure that we're making, again, the right investments for our team.
And from your vantage point as the CEO, is that single source of truth, having that data in one place, allow you to analyze the operations of the business differently?
Absolutely. I think it helps us just break down the silos between departments. As Asia mentioned, in our EMR system, it was telling us what we did. But this tells us what our potential is, and I think from all different angles. Just having that data of coordinating between the teams, if what's holding us up is that we don't have insurance authorization, how do we deploy our resources more effectively so that we can translate these referrals into patients that we're serving? So it really has gone across all different departments within our organization, and just having that single source of truth, that real-time data, helps us make more strategic decisions so we're being more efficient with our resources.
Ultimately, this is all about, to steal your phrase, the kiddos. It's about the families and the patients. How has Skedulo allowed you to provide better care for them?
Our biggest thing at Solace is making sure that we're taking care of these families. And the way that we do that is by taking care of our clinicians. If we can take that administrative burden off of their plates, if we can let them go out and be clinicians and do what they're trained to do and serve these families, then these families ultimately get better care. If they can really focus on their treatment sessions and new evidence-based practice models and interventions and less time driving around and trying to figure out what's the best place for this new referral, then we're doing them a service so that they can serve their families.
From a big picture, everything Asia said, I 100% agree with. It's really been transformational for what we're able to provide for all of our customers. On every individual level, there's so many different ways that we've ended up using Skedulo that we didn't even imagine really a year ago when we started moving down this process. And I think that's what we love about the Skedulo platform. We know that will be different in another year, and so we feel like we've got a great partner and that we're able to continue to transform how we're using it and really better the lives of our families and our clinicians. Just in our first quarter, we wrapped up our first full quarter on Skedulo and found that we had decreased our no-show rate by 84%. And it's such a phenomenal metric, but really every one of those has a huge impact. So for our clinicians, when they're able to go out and they're confident that their families are not going to forget about that appointment and they're not going to be spending half of their day at Starbucks, they're happier. And then for our families, we know that those families that consistently can access our services, they just make faster gains towards their goals. That alone, and I think that's a symptom of one, having more efficient schedules, and two, those text reminders. And that's such a simple thing that so many other industries are using that we should absolutely be using in home health and supporting our families in that way.
I love hearing how you're treating your stakeholders as customers and really working hard to provide a better customer experience and working hand in hand with Skedulo to do that. And it's really great.